my name is B. Finney, and I've been seeing Dr. Copeland, I'm going to guess, for
God, 15 years
15
probably.
years,
Yeah.
and I've come in, every maybe 2 or 3 times a year, and I usually get instant relief for my adjustments.
Yeah.
And I like the way he does adjustments. They're very gentle. He's not overly aggressive, and I usually walk out the door thinking, I should come here more often.
Yeah. But you have a very intense job. I mean, it's hard to get over here because you kind of have those long hours and all that. Do you want to just state what you do? I think it's fascinating.
I'm an emergency room nurse at both of the hospitals here in Santa Cruz County. I've been doing that for 32 years, and if that doesn't beat up your body, I don't know what does.
Yeah, and you put in long hours, you guys, not don't you, nursing?
We put in long hours, and they're hard, and there's a lot of physical things to it: bending, lifting, stooping, pushing, pulling.
Right, yeah, to really, I mean, you hold up for the most part, but then when the muscles pull too hard, they pull the vertebrae into fixation.
Yeah.
And as you well know, I mean, you see it all the time, nothing else really helps except the adjustments you're getting here.
It's the best way, because I can, over-the-counter stuff doesn't adjust your spine.
Yeah, right. Great. Yeah, anything else you want to say?
I just want to say that I really appreciate Dr. Copeland, that I followed him from his last office to here, and that I would say, and I have told patients over the years that come in with musculoskeletal pain and are looking for relief, when this acute injury is over, or whenever your doctor says you're okay, I would recommend chiropractic.
Yeah, and come to think of it, you've sent in a lot of people over the years, and a lot of nurses come here, good?
Yeah,
and
it just makes sense. It makes
sense.
sense.
MDs, actually.
Yeah.
Yeah, which is good to see.
Yeah. I'd like to see the physicians in the emergency room writing referrals to chiropractic. They don't do that, as I think that would be more helpful.
Even though a lot of patients come in and say the MDs they actually do recommend not a particular chiropractor, but they say,
in general.
In general, yeah, we can't really help you. We can only give you pain meds, but your vertebrae are definitely stuck.
Yeah.
And stretching, at a certain point of fixation of the vertebrae, stretching isn't going to just release it out. It can't.
Yeah.
And that's why we're here. Great. Anything else in your closing comments here?
I would just recommend chiropractic to people that are in pain and want to get out of pain, or people that want to stay healthy. Well, I'd like to comment. I think that the medical field has recognized chiropractic as a legitimate source of treatment. It's covered by insurance plans. I mean, if it were some kind of quackery, it would not be covered.
Right.
And I think, there's a lot of harm that can come from having surgical procedures that don't necessarily repair things that, some patients end up with chronic pain or worsening symptoms, have to have other procedures. And, I think that it is true, if you can balance your nervous system and your spine, your body will be able to heal and recuperate from most things. We have that regenerative quality in our cells, and aren't we lucky, because we do a lot of abuse,